Dr. Redd. We've been trying to get people to get screened, and we have a big question mark here. I know it looks like a question mark if we want to draw a big circle on the bottom, but this isn't a question mark. What is it?
This is a diagram of a colon. It's a picture of a colon.
And you do a lot of different things with colon cancer. You yourself have been screened several times.
Yeah.
So tell me about that.
Well, when I was in private practice, I had a lot of patients that would develop colon cancer, and sometimes we'd diagnose them when they had pain in their abdomen, they had blood in their stools, different things would happen, and we'd go do all the tests, and we'd find out, oh, by the way, you've got colon cancer, it's stage 3 or 4, it's spread to your liver, it's spread to your lungs, and there's really not very much we can do to help you. And then other times we would screen people and say, you know what, you really should go get a colonoscopy, and we'd find polyps in their colon and say, hey, you know what, here we've got a polyp, we can fix this, we can,
I've seen you on YouTube, and you draw a little diagram of what these look like. So will you show me what that is?
I've got my little red magic marker here.
Exactly.
So polyps are kind of precancerous lesions, and they sort of will grow at different places in the colon. They might grow here, or they might grow another one here. And they grow pretty slowly. They start off as just little tiny, like skin tags almost, but the inside of the colon. And if you leave them there for a long time, some of them, not all of them, but some of them can potentially turn into cancer. And when that happens, they start to grow they start to fungate and look kind of like a cauliflower lesion on the inside of the colon. And eventually they spread through the wall of the colon and into the inside of your abdomen, to your liver, in different places. So the important thing with colonoscopies and getting screened is you need to detect these things when they're still polyps and not cancers. You need to detect them when they haven't already turned into a cancerous lesion. And the way we do this with a colonoscope, it's just a big long black tube about as big around as my thumb. Mm-hmm. It goes up through the anus to your bottom. And it goes in there, and the doctor, looking through the scope, can see this polyp. He can go with a little pair of forceps, little pinchers, snag that little polyp, cut it out, and pull it back out, and voila, you got rid of the polyp.
That tiny little thing that was probably, could be or couldn't be.
Could have turned into cancer, but now that you've gone in there and gotten screened, you've actually cut the polyp out, and you've actually prevented the cancer from ever developing in the first place by actually getting the colonoscopy done.
And what age do you usually suggest that this be done?
People who don't have any family history of colon cancer or other illnesses that would increase the risk of colon cancer should get screened to get their first colonoscopy when they're 50. People who have family history of colon cancer or family history of multiple colonic polyps should get screened earlier. They should talk to their physician about when to do that. If you have and when I say family history, I'm talking about your brothers, your sisters, your parents. If they have colon cancer, then you really should get screened earlier than age 50.
And you've had it done several times just to be the guinea pig, right?
Well, it's a long.
What's a little bit of experience with that?
Well, this is the issue. So like some people have symptoms of colon cancer that maybe colon cancer might be something else.
And what might those symptoms be? I mean, I know this is obviously you've talked with your family physician, but
this is really hard. First off, if you have a change in your bowel movements, or if you have blood in your stools, or things like that, you might already have colon cancer. You don't want to wait till I have symptoms before you get screened. Yeah. But if you have those kind of symptoms, you could have other diseases too besides colon cancer, but you really should get a colonoscopy. So, in my early years when I was in my 40s, I'd had all these patients die from colon cancer or get colon cancer that hadn't never been screened. And I said, hey, you know what, I need to get screened because I'm having some of these symptoms. And it turned out it was just hemorrhoids, but I needed to go ahead and find out what the deal was. So my first colonoscopy was probably about 10 years ago, or more than that maybe. And I went in there, took the prep, drank all this fluid, flushed all my intestines out. That wasn't exactly a fun experience, but it was okay.
I hear you don't remember it either, so that's good, right?
Well, most people, once they get cleaned out, that's something you do at home before you go in, okay? And then you go into your doctor, to gastroenterologist, and the doctor gives you an injection medication that kind of makes you relax and doesn't put you completely to sleep, but makes it so you can't remember anything. And then we
always like that.
You don't want to remember this. So anyway, then he'll go up inside the scope, and the scope goes all the way around, all the way over this other side, and it's
quite long.
It's a long scope, okay, and it takes a while to get that done, and it's really quite uncomfortable when you do it. So it's nice to have that medication, so you don't have to be in pain and don't have to remember it.
Well, you know, we're doing this campaign thing, Get Screened, and Win a Flat Screen TV, which we hope everyone gets out there and gets screened for all types of cancer. But we want to thank right now our sponsors, which is the Valley Channel, Bear River Health Department, that's you guys here at Bear River Health Department, Logan City, and then we also have the Women's, Cache Valley Women's Center, where you can get, you know, checked for cervical cancer, breast cancer. We have Icon Fitness, Sports Academy, Intermountain Logan Regional Hospital, where you can also go and talk to your physicians there about all kinds of screening. Logan Glass, Priority Health Center, Dr. Tuff, Weight Loss, Cache Valley Specialty Hospital, Lynn's Audio Video, who's nice enough to give us the TV, and Watkins Printing, Rocky Mountain Dermatology for skin cancer, and Wendy's. So we'd like to thank them, and we're going to announce the winner at the Run for Your Life race that will be at Cache Valley Specialty Hospital May 7th, and you can register at Runners North. So we'd just like to thank our sponsors, and we'd like you guys to get in and get screened as soon as possible. Thanks. Thanks, Dr. Redd. Appreciate you.